This is Fred Lippman. Welcome to Dateline Health. We come to you from Nova Southeastern University, and today we have a show which really comes about by not only your interests but by a lot of the headlines. We're going to be talking about the opioid drug epidemic, and more specifically, I would say, even though that's the point of insertion into the conversation, we're going to talk about substance abuse, which will include pharmaceutical products that are in the medicine cabinet or on a shelf in the kitchen or whatever. So let me introduce to you one of really this country's leading epidemiologists, and is here as the Center for Applied Research on Substance Abuse, an incredible human being, Jim Hall. Welcome, Jim.
Thank you, Dr. Lippman.
Good to have you, sir. And Dr. Matthew Seaman, also an attorney as well as a pharmacist, is an associate professor and chair at the College of Pharmacy. And he's extremely knowledgeable, not only relative to pharmaceutical issues, but to the laws that affect the whole issue of substance abuse and pharmaceutical distribution. Welcome, Dr.
Thank you.
Seaman, otherwise known as Matt.
Yep,
I'll
sounds
call
good.
you Matt. You're always Matt to me.
That's great.
Okay.
Look forward to being here. Thank you.
Jim Hall, we have an epidemic. Most people understand that we have an epidemic based upon products that were sold illegally. We had the pill mills and we had everything, but now we have the heroin distribution issue. Let's give the folks an idea of how serious this is.
Well, it's quite serious, and in actuality, it's a pandemic nationally. The Centers for Disease Control has declared that this is impacting every state in the country, but also almost every county in the nation. Here in Southeast Florida, as well as across the country, this is really an opiate epidemic that combines either prescription opioids or even illicitly manufactured opioid analogs, as well as street heroin. And what it is an epidemic of addiction and an epidemic of deaths. Here in South Florida, we are seeing, on an average in 2015, the most recent data that are available, an average of an opiate overdose every 2 hours and an opiate death every 6 hours. So this is truly an epidemic in rising proportion, and the estimates for 2016 are already almost doubling what we saw last year.
Matt, Dr. Seaman, as a pharmacy professional and as a leader in communicating with our student populations and your pharmacy professionals, I know how concerned they are. So give me some thoughts.
Yeah, I mean, it's as Dr. Hall mentioned, it is definitely a pandemic. You know, I speak to the students all the time, and in our program, they're working in a pharmacy, and they see this every day. The prescription side of the opiates. They go to work, and they're concerned when these patients come in. They're concerned that physicians are inappropriately prescribing. The patients are seeking medications for inappropriate use. They're concerned about their safety oftentimes. There's, you know, in the news, there's history of robberies and burglaries of pharmacies. It's really influential and significant at this point. You know, I like to refer to to the opiates and the prescription drugs as their pharmaceutical grade heroin. That's what it is. In the pharmacy, we have access to, and we treat patients with this pure, great product that has its effectiveness but also has its risks.
Pharmacy has always had the responsibility to handle products that are addictive, but also palliative. It affects not only the distribution points known as pharmacies, the legal distribution point, and the doctor's offices. But more importantly, Jim Hall, it's become a major entrepreneurial enterprise on the streets of our country.
The profits involved in the opiate epidemic for even just mid-level dealers are just astonishing numbers. And that is also what is very much driving this epidemic, along with the addictive nature of people first becoming dependent upon prescription opioids, whether they are legally prescribed them or they've gotten them in the underground market. But in 2016, the most dramatic story and what is fueling the epidemic of deaths is the introduction of illicitly manufactured opiate analogs such as fentanyl from foreign clandestine labs, primarily in China, that are ordered online in kilogram quantity by mid-level dealers for just a few $1,000s or less, and that can produce $50,000 to $70,000 in profit on a $2,000 investment. So there is an incredible entrepreneurship. When I was asked by the Chinese government of why China was involved in this, and I accused them of narco-capitalism. And actually, the Chinese government has been fairly cooperative over the past year. They banned 116 different of the synthetic research chemicals, but there's still hundreds more out there to take their place. Nonetheless, we're aware of these extremely potent analogs, carfentanil as well. We've had deaths here in South Florida associated with this powerful, elephant tranquilizer that is among other fentanyl analog deaths that we're seeing. These analogs are either mixed with heroin to fortify its potency, or just sold as heroin itself, or even more recently, the very distressing issue of counterfeit pills, both alprazolam or Xanax tablets containing fentanyl analogs, as well as other prescription opioid that contain actually the illicitly manufactured. In fact, that's the combination that killed Prince, as well as it's killing many others.
You know, thank you, Dr. Seaman. For many, many years, and there's a balance that has to be sought out here somewhere. For years, I mean, in the years that I was an active professional in the field of pharmacy, we always dispensed opioid products. We dispensed, I remember, tincture of opium as an eardrop for the examination of children that had, an infected ear, because there wasn't any better analgesic that was topical analgesic that was used by the ENT folks. But we had a responsibility. We used it, etc. And it's still to this day, there's this discussion now between the people who truly need it, the cancer victims and others that are not gaining access to the legal distribution areas of these products because of the fear of the individual pharmacy, not the pharmacist, but the pharmacy management, to prevent the discipline, not to prevent the naming of that store as an available site. What do you hear about that?
Yeah, I mean, absolutely. It's a floodgate. You know, pharmacists, they recognize that if they start to fill those prescriptions, there's going to be a line out the door. So, use the word balance. You're absolutely right. It's a very difficult situation for the pharmacist, because you want to treat that patient that comes in with sickle cell disease or cancer, pain. That's our professional oath. That's our professional job. What do we do with these addicts out there who come in with these prescriptions that are valid, fraudulent, close to being valid, it's a real difficulty. So accessibility is really the key, and it's challenging because you've got the DEA who's sort of over your shoulder as a pharmacist because they register the pharmacy and they watch the quotas, they watch what's being delivered into your pharmacy, and if there's a spike, you can expect a phone call or a visit. You've got the patients who come in, and it's hard to look at somebody and know what their history is. If you try to maybe contact a physician, sometimes it's difficult to get in touch with them to get a clear answer. You look for board certification of the physician. If they're board certified, maybe you feel a little bit better. Florida did a great job of responding to the issue. They developed a prescription drug monitoring program where pharmacists are able to go in and see if patients are doctor shopping or pharmacy shopping. You're able to see what they're getting. But even that, it could be manipulated lots of different ways. There's lots of vulnerabilities in the situation. But pharmacists, we take our job seriously. We want to help patients, but we also don't want to sort of add to the epidemic. And what's really problematic is it's just a moving sort of scheme that if we cut out the opiates, which pharmacists as professionals within an FDA regulated society maybe we feel good about, but then they're going to go out in the streets and they're going to substitute it with heroin or this Chinese fentanyl or whatever counterfeits available to them.
Jim, in reviewing some of the details that you provided to me before the program, it's striking to me. You mentioned the number of deaths, and the number of overdoses, but I also I want you to talk about the use of naloxone. But I noticed that our first responders, our police and fire people, our hospitals are becoming quite knowledgeable as to what to do when a patient comes in that has been involved with an overdose.
Well, certainly naloxone, or brand name Narcan, is the key drug to save lives. It will reverse an opiate epidemic. It's important, though, that it be used immediately to reverse an opiate overdose. And it's important, though, that it be used as quickly as possible. Therefore, it's very important that it's widely available, certainly to first responders, police, as well as paramedics. Most all paramedics now have access to it. And certainly it is the drug that is saving lives in the emergency room. It is also now available without a prescription in the state of Florida. Not all pharmacies, though, are carrying it. So it's important for particularly significant others and family members of both legitimate opioid patient on opioid medications, as well as known substance abusers involved in the heroin or opiate epidemic, to have naloxone available to them. It's easily administered in either a nasal spray or as well an auto injector. One of the issues is that not all insurance covers the cost of naloxone, and that unfortunately has also been escalated recently by the pharmaceutical industry, so it's far more expensive than it was just a few years ago. The more potent opioid analogs that we're now seeing also require increasing dosage levels of it every 2 minutes until the person regains the ability to breathe. So it's an important tool in opiate reversals. In North Carolina, they have a major project that is referred to as Project Lazarus, literally returning from the dead. One of the things that's missing, however, in our policies with the use of naloxone is to provide the appropriate intervention. Manatee County in Florida now has an ordinance that any paramedic patient that receives naloxone and who refuses to go to an emergency department then will be mandatorily, under the Marchman Act, placed into addiction treatment counseling and programs. So we really need to focus, particularly at our hospitals, of not just treating and streeting these clients, but getting them linked in with appropriate counseling for both the patient as well as their family members, and linked into the treatment options that are available. Our only way out of this epidemic is to expand addiction treatment availability. Now, there are multiple domains of addiction treatment for the opiate epidemic, even from just a private physician who's certified. But also we need to make more readily available and have insurance coverage for addiction treatment programs. Federally, we tried to have a $1.1 billion increase in treatment funding in the federal budget. All we got was $100 million. So hopefully we will see with the new Congress an expanded funding of addiction treatment. When Florida had its crackdown on pill mills, we were very successful in incorporating numerous policies, including the Prescription Drug Monitoring Program, to counter the supply of diverted opioid medications. What we failed to address at that time, back in 2010 and 2011, was the expanding addiction treatment availability, the need for addiction treatment. So it's a three-prong effort. It does involve law enforcement, certainly involves prevention, as well as treatment availability. One great effort here in South Florida is the DEA is organizing a multiple domain program called 360 Degrees to address the opiate epidemic, as well as our local counties are forming their own community response teams to the opiate epidemic. Particularly Broward County has been a leader in this, following the model that they followed with the Flakka epidemic last year. So while this is a national problem, it also has very much focused on community level solutions.
Yes, you know, again, my memory brings me back to this. I mean, I've been involved over the years in in fact, my first community activity was sitting on the board of the Hollywood Chamber of Commerce to discuss the substance abuse issues in the community, and this was a long time ago. This was in the late 60s. And then, you know, as a practicing pharmacist and watching people come in, and we had this really the terrible problem of pharmacists being under siege by a lot of individuals that were addicted to amphetamines and opioids, particularly heroin and cocaine. And what pharmacy professionals went out, and we created laws in the state of Florida, and then it became national relative to the purposes of obtaining drugs with the use of a weapon or causing harm to the pharmacy professional or people in the stores. And the sentences became broadened, and they became very long. But it didn't talk about the issues of these people needing intervention. And Matt, you sort of referred to it, because today we're not seeing that much.
Nowadays, though, the patients are in the pharmacy and they pick up their Suboxone prescriptions every month, which is a drug that helps address their addiction. So it's sort of a subtle change. I mean, you know, not that long ago, early 2000, you know, there were pharmacies, they would hang signs, "We don't have Oxy, you know, stay away." Whereas, you know, now I think, I'm not really sure, but there's more funding. In 2016, the President and Congress worked to pass the Comprehensive Addiction Recovery Act. So it's becoming sort of more and more, at least funded and addressed. We're starting to work towards, you know, to getting new products, to helping to control the patients. But I think, you know, addiction is an age-old problem, and I'm not sure that you're ever going to fix it. I think we're just sort of building an enterprise around it just to keep the economy flowing.
The one good thing that I say is, at least now, with television being so ubiquitous, and there are so many stations, everybody's watching, most people are watching cable, that you see all these ads now for these various programs that are advertising to bring people in for counseling and for substance abuse, I guess you could say, treatment. What's your thoughts about it?
Well, of course, the common denominator in all of this is the disease of addiction. And while with different substances, there are different characteristics to that addiction, as well as different approaches, and even in the pharmaceutical medically assisted treatment, different options depending on the substance of abuse. However, the key focus for addiction treatment is to lead the individual to recovery. And then what we must do in our communities is to have a wide-scale environmental support system for recovering persons. One of the really phenomenal new organizations across the country in recent years has been a group called Young People in Recovery. And this is involving young adults and middle-aged folks who have overcome the addiction problem and are actively seeking to work to bring others into the recovering community. We must break the stigma of addiction in our society. This, like any other disease, needs to be considered primarily a public health issue, and other resources that we have are to support that public health effort. We definitely need expanded treatment. Unfortunately, the ones that you see often advertised with the slick television ads are also the kind of industrial, corporate, profit-oriented addiction recovery. We have many local nonprofit programs that are supported with public funding as well as insurance. And we also need to expand insurance coverage for treatment. Our only way out of this epidemic is to treat addiction and to support recovery.
We're going to have to get our hands on this thing because it's very dangerous for our society. Dr. Seaman?
Yeah, no, absolutely. And I think, you know, that a venue like this sort of helps get the word out. We have experts out there doing great research, which is an important, you know, piece to the puzzle. We have the clinicians, the pharmacists, the physicians, these rehab facilities as well, that, you know, that's what their job. So, and it's nice to be at the university where that's a message that we try to spread far and wide.
Yeah. Jim Hall, you are at the Center of Applied Research on Substance Abuse here at Nova Southeastern University. We're down to the last 2 minutes of this show, but I want you to really let the people know what your goals are and obviously what your mantra is.
Well, at the Center for Applied Research, we are focused on the whole issue of substance abuse and how it relates to other health disparities. So we are doing active research. One of our key areas in this particular field was the early identification of the foreign illicitly manufactured analogs, and we identified their source of primarily coming through Canada from China, and how that is spread throughout North America in 2016, as well as with the counterfeit pill related issues. But this epidemic requires family members and friends of individuals who are involved in this addiction to learn more. Just go online, seek help on intervention, learn what you need to do to understand addiction, and most importantly, what you can do to help the person you love and care for.
Thank you, Jim. Thank you, Jim Hall. Thank you for all your hard work. I know you've dedicated your life to this whole issue of substance abuse and the characteristics of not only the writings that I've had the privilege of reading, but the work that you're doing is a blessing to our audience and to our society in general. We want to thank you very much. Thank you.
Well, thank you, but it's very much because of working with the community. We can't do this in isolation, and our anti-drug coalitions in Southeast Florida are among the leading groups in the nation in addressing this problem.
Thank you. Thank you very much. We're down to the last 15 seconds of this show, so I've thanked you, Jim Hall, and Dr. Max Seaman. Once again, you're an expert in many, many fields, not only being a highly skilled and educator and a professor at the College of Pharmacy, but also as an attorney, and it helps out every once in a while. It helps the shift of your thoughts, and and enables our student population to understand what their responsibilities are and also the effectiveness of what they could do. So thank you very much. I appreciate you being here. Folks, I know this is a very difficult subject, and we didn't talk about how we can help you with your cardiac disease or interventional clinical operative procedures or minimally invasive surgery, et cetera, et cetera. But this is very important. This is very important to you. It's very important to your family. It's very important to our society. It's an epidemic that could cause some great problems here in this great country, the United States of America. So I thought we would give some time to discussing it. I want to thank you for your inquiries every once in a while about what do I do about my son, my daughter, my aunt, my uncle, whatever, about, and I'm leaving some people out, about overdosing and overutilization of prescription drugs. So we wanted to bring this show to you. And like I said, Jim Hall and Dr. Max Seaman are not only advocates for your behalf, but advocates for their profession. So thank you very much for turning in this week. Remember, I always tell you to take good care of yourself. But I want to add a little something that Jim Hall said. Be cognizant of what's going on around, and don't be fearful of trying to get them help. There are a lot of people out there that want to help. And so once again, this show is called Dateline Health. There's a telephone number and an email address right here if you need it. And until next time, this is Fred Lemon coming to you from Nova Southeastern University saying, see ya.